Hello, my name is John Benson and I'm a psychiatric nurse practitioner, and today we're going to be talking about SSRIs. Selective serotonin reuptake inhibitors are a class of medication commonly prescribed first line for mental illnesses such as depression, anxiety disorders, and obsessive compulsive disorder. Today we'll cover fluoxetine, Prozac, sertraline, Zoloft, escitalopram and citalopram, Lexapro and Celexa, paroxetine, Paxil, and fluvoxamine, Luvox. SRIs alter the concentration of chemicals known as monoamine neurotransmitters in the brain. They work mainly with three neurotransmitters: serotonin, which is involved in feelings of well-being; norepinephrine, also known as noradrenaline, which promotes attention, energy, and possibly anxiety; and dopamine, which is involved in pleasure and satisfaction. SSRIs work by causing larger amounts of neurotransmitters to remain in the connecting area between brain cells called the synaptic cleft. All SSRIs increase serotonin, but some SSRIs also increase norepinephrine or dopamine. Neurotransmitter concentration increases can cause side effects right away, but the therapeutic effects on mood and anxiety of SSRIs typically take 2 to 4 weeks to appreciate. Why? Two leading theories are that elevated monoamine concentrations gradually increase the speed of brain cell function and cause the release of brain-derived neurotrophic factor, BDNF, which slowly causes the creation of new brain cells. To improve tolerability, we generally suggest a slow increase in dose when you first start. For example, taking 1/2 of the standard therapeutic dose for 1 or 2 weeks. SSRIs are the first-line treatment for many mental health issues, including major depressive disorder, generalized anxiety disorder, obsessive compulsive disorder, panic disorder, premenstrual dysphoric disorder, post-traumatic stress disorder, and social anxiety disorder. They are commonly prescribed for bipolar depression, but should be used with caution in this population, as many experts believe they may exacerbate the intensity and frequency of manic symptoms, like increased energy, anxiety, impulsive behaviors, and irritability. Benefits of SSRIs may include a reduction in negative or obsessive thoughts, improved motivation, a consistent appetite, increased energy, improved sleep, and a reduction in anxiety. Despite being classified as antidepressants, many experts believe that SSRIs are more effective at reducing anxious symptoms, especially bothersome recurrent negative thoughts known as ruminations, and that this yields the majority of their clinical benefit, as depression and anxiety are strongly related conditions. For example, very high-dose SSRIs are used as the main treatment in reducing bothersome thoughts in even the most severe cases of obsessive compulsive disorder. The recommended timeline for treatment for most people is 3 to 12 months. However, many may benefit from longer periods of treatment, sometimes for several years. Patients who are likely to benefit from longer treatment include people who suffered a history of child abuse, had depressive symptoms for the first time at an early age, have had 2 or more depressive episodes in their life, frequently think of hurting themselves, have a very stressful lifestyle, and people with anxiety disorders or obsessive compulsive disorder. SSRIs are safe medications. Millions of people worldwide take them, and most of them have minimal side effects, if any. Most side effects resolve after 1 to 4 weeks of treatment. SSRIs have minimal risk of weight gain if taken for short periods of time, for example for 6 months or less. Whether or not SSRIs cause weight gain in long-term use is still controversial. However, several studies suggest that long-term use of fluoxetine, Prozac, and sertraline, Zoloft cause less weight gain than placebo. The SSRI with the highest risk of inducing weight gain is paroxetine, Paxil. It's important to note that depressive and anxious symptoms often cause a severe reduction in appetite, so an increase in food intake may actually be desirable. Healthful diet and exercise patterns are essential for preventing weight gain and are beneficial on their own for reducing depressive and anxious symptoms. SSRIs have the potential to cause what are known as anticholinergic side effects. These include constipation, dry mouth, blurred vision, and difficulty urinating. These tend to be more severe at higher doses. Consider a dose reduction or a switch to an SSRI with a lower risk of causing them. The main medication that causes these issues is paroxetine, Paxil. These are least common with escitalopram, Lexapro, and sertraline, Zoloft. SSRIs can also cause short-term increases in nausea, loose stools, headaches, anxiety, insomnia, and drowsiness. These also tend to resolve after around 1 month. Headaches can generally be managed with over-the-counter pain relievers like acetaminophen, Tylenol, and ibuprofen, Advil. If an SSRI makes you drowsy, switch to taking it before bed. Gastric issues, like nausea or loose stools, can be reduced by taking the SSRI with food or taking half of the dose twice per day. We can control a short-term increase in anxiety or insomnia by adding a medication like hydroxyzine, Vistaril, propranolol, Inderal, Trazodone, or in rare circumstances a benzodiazepine like the Razepam, Ativan. The most frequent side effect of SSRIs is sexual dysfunction. This can present as a decrease in desire, lubrication, ability to achieve an erection, or to achieve orgasm. These side effects generally go away after around 1 month, but they can persist, especially at high doses. The most common strategy for reducing this side effect is taking the lowest effective dose, or 1 or 2 day drug holidays. Another strategy is adding the medications buspirone, Buspar, trazodone, or mirtazapine, Remeron. Some may also consider switching to an antidepressant with a lower risk of sexual dysfunction like bupropion, Wellbutrin, vilazodone, Vibarid, or vortioxetine, Trintellix. In 2018, an influential New York Times article titled "Many People Taking Antidepressants Discover They Cannot Quit" popularized the concept of antidepressant discontinuation syndrome, a period of uncomfortable side effects such as nausea, poor concentration, restlessness, or unusual zap-like nerve sensations that occurs when you stop an antidepressant. How common is this? About 1/3 to 1/2 of patients will experience some degree of these symptoms, and about 10% may experience them for an extended period of time. It is believed that use of SSRIs beyond the doses listed here, as well as long-term use, like 1 year or greater, are risk factors. However, most people don't have any major problems with dose reductions of 25 to 50% every 2 or 4 weeks, and some especially med-sensitive people may require dose reductions of 10% or in rare cases 5% every 4 to 6 weeks. A transition to an equivalent dose of fluoxetine, Prozac, can be helpful for tapering down, as this SSRI has a very long half-life. There is some plausibility to the idea that SSRIs can cause bleeding. SSRIs may block the accumulation of serotonin in blood platelets, which prevents the formation of clots. Please inform your provider if you noticed easier bruising while taking your medication, and provide a complete list of medication to all providers. Risk factors for bleeding include having relevant medical conditions like a clotting disorder, chronic liver disease, or a stomach ulcer. Other risks include routinely taking medications like NSAIDs or blood thinners. Serotonin syndrome, better defined as serotonin toxicity, occurs when serotonin concentrations in the central nervous system get too high. It exists on a spectrum from barely detectable to life-threatening. Signs of severe serotonin toxicity include fever, high blood pressure, shivering, over-responsive muscle reflexes, and muscle rigidity. The risk of this happening from a normal dose of just one serotonin-promoting drug like an SSRI is minimal. Danger generally occurs when SSRIs are combined with generally high doses of other serotonin-promoting drugs such as opioids like tramadol, Ultram, buprenorphine, Suboxone, Subutex, and methadone, or stimulants like amphetamine, Adderall, Vyvanse, methylphenidate, Ritalin, Concerta, cocaine, and MDMA. Other risky combinations include the supplement St. John's wort, the cough suppressant dextromethorphan, Robitussin, and lithium. The highest risks are generally from other antidepressants including SNRIs, for example, venlafaxine, Effexor, and especially the now rarely used MAOI and tricyclic antidepressants including tranylcypromine, Parnate, amitriptyline, Elavil, and doxepin, Senequan. In rare instances, SSRIs have been reported to cause what is called akathisia, a subjective feeling of restlessness often leading to excessive movement such as fidgeting legs or pacing. Risk factors for this include having an existing movement disorder like Parkinson's disease, a genetic inability to metabolize the SSRI, a very rapid dose increase of the SSRI, or taking another medication associated with movement side effects such as an antipsychotic. Like other nuisance side effects, akathisia is often self-limiting and propranolol, Inderal, may help control the symptoms short term. Akathisia nearly always goes away when the SSRI is stopped. In the early 2000s, the FDA issued warnings that antidepressants, including SSRIs, may increase the risk of suicidal thinking, planning, or attempts by people 25 and younger. Two potential explanations of increased suicidality include the risk of SSRIs inducing either mixed or manic states in undiagnosed bipolar disorder or akathisia. In 2007, an influential study by biostatistician Robert Gibbons claimed that the FDA's warnings led to a nationwide reduction in youth antidepressant prescriptions, which in turn led to increased youth suicidality. Given the gravity of this potential side effect, we should not entirely dismiss it. We recommend frequent follow-up appointments with at-risk individuals, such as 1 or 2 weeks after medication initiation or dose changes, to monitor for signs of suicidality. Please reach out to us, your local crisis center, or 911 if you start having thoughts of hurting yourself. You can find links to crisis resources in the FAQ of our website. Escitalopram and citalopram are actually the same drug. Escitalopram is simply a slightly more refined version of citalopram. They are the purest SSRIs. They only significantly increase synaptic serotonin, not other neurotransmitters. Escitalopram is approved for children 12 and older, and they have the fewest drug-drug interactions of all the SSRIs. Very high doses of these medications can delay what's called the heart's QT interval, which in rare circumstances can lead to serious heart rhythm problems. Other risk factors for QT interval delay include other QT prolonging drugs, an imbalance of blood electrolytes like potassium, heart disease, or an existing arrhythmia. In rare high-risk individuals, we recommend a measure of heart rhythm called an electrocardiogram prior to starting an SSRI. In addition to serotonin, fluoxetine, Prozac, also increases synaptic concentrations of norepinephrine, especially at higher doses, which can cause a desirable boost in energy and attention or an undesirable increase in jittery anxiety or insomnia. It's the longest acting of all SSRIs, with a half-life of approximately 2 weeks, meaning it's best for people who may miss daily doses or people seeking the lowest possible dose due to sensitivity. It's the only SSRI approved for children as young as 8. It's a potent inhibitor of the liver's CYP2D6 enzymes, leading to many potential drug-drug interactions. In addition to serotonin, sertraline, Zoloft, also increases synaptic dopamine levels. Other benefits include being the safest SSRI in pregnancy, lactation, and heart rhythm issues. It is also the most likely SSRI to cause diarrhea. It has minimal drug interactions if taken at or below 150 milligrams, and beyond that it's a moderate CYP2D6 inhibitor and shares the same interactions as fluoxetine, Prozac. It can dramatically raise blood levels of Depakote, Depakine, valproate, valproic acid, digoxin, and warfarin, Coumadin. Fluvoxamine, Luvox, is an SSRI that has only been approved by the FDA for the treatment of obsessive-compulsive disorder and social anxiety disorder, and is generally not first line for generalized anxiety or depression. Despite its indication, there is no evidence that it's more effective than other SSRIs for OCD. It has a short half-life and often requires twice-daily dosing. It inhibits multiple CYP enzymes, leading to a very high risk for drug-drug interactions. As of early 2022, it's being investigated as a treatment for COVID-19 infection. Paroxetine, Paxil, is often thought of as the most effective agent for anxiety, but carries many drawbacks. It is generally worst in class for weight gain, sedation, anticholinergic side effects, sexual dysfunction, discontinuation syndrome, and is least safe in pregnancy and lactation. It's also an inhibitor of CYP2D6 and 2B6, leading to many drug-drug interactions. It is generally not recommended unless a patient has a positive family history with it or other SSRIs have failed. Combining alcohol and SSRIs will generally enhance the sedative effects of alcohol and may cause you to become excessively drowsy, dizzy, or uncoordinated. In general, alcohol use can exacerbate symptoms of depression and anxiety. There is minimal research on the effects of combining SSRIs and cannabis. Some research suggests cannabis products, including CBD products, can increase blood levels of certain SSRIs and may exacerbate side effects. There is also minimal research on the risk of combining SSRIs and hallucinogens such as psilocybin mushrooms, DMT, or LSD. Theoretically, this combination could induce serotonin toxicity. The hallucinogen with the highest risk of causing serotonin syndrome is ayahuasca, as it contains an MAOI. Conversely, there is some evidence that the use of SSRIs can blunt the psychedelic experience. It appears to be a safer practice to stop SSRIs for at least 5 weeks before using any hallucinogen. SSRIs are not believed to have any major interactions with ketamine. If you're prescribed ketamine, please make sure to give your provider a complete list of all medications that you are taking. We do not encourage the use of illicit substances. Recap question 1. How long does it take for most nuisance SSRI side effects to resolve? The answer is B, 1 to 4 weeks. Recap question 2. What is the most common SSRI side effect? The answer is C, sexual dysfunction. Recap question 3. How long do most clients take an SSRI for? The answer is A, 3 to 12 months. Are you a resident of Texas or Oregon seeking psychiatric care via telemedicine? If so, visit bensonbh.com and click New Patients to complete a brief intake form. You'll receive a phone call within 1 or 2 business days.